My name's Linda Keefe. I'm a nurse and program coordinator with the Needle Exchange program in Prince George, and I've been with this program for 20 years. I think if we want to normalize HIV testing, what we have to do as health professionals, social service providers, and corrections, as a community, we need to look at what our role is in supporting people and challenge some of our existing attitudes and the stigma and discrimination that many people hold around HIV and some of the risk behaviors that put people at risk for HIV. I think we have to make a commitment to work together, and so that we can talk about HIV testing in a way that allows us to provide hope and encourage change in people's behavior, not just put the onus on the individual to get tested. I think the message that I would really emphasize to people is that having a diagnosis or not having a diagnosis doesn't change who you are as a person, and it doesn't change your HIV status. You don't become HIV virus with a diagnosis. You are still the same person that you were before. You're just now aware of something that you weren't aware of before. And that people need to remember that that about themselves and for other people beside them. Because I hear people with HIV say, I'm HIV now. And I say, hey, I'm Linda. When did you do the name change, you know? You don't become the virus. You're still the person. HIV does not discriminate against people based on their gender, their ethnicity, their age, their socioeconomic class. And we've seen people over the years, who've come in that really represent all kinds of occupations in this town, all kinds of professional occupations, who've had different kinds of risks, and I think that it's important for us to realize that anybody can get HIV infection, and that if they're concerned, they should call in, and we can help also. I think that a lot of professional people may have a real fear around being identified as, entering into testing services, and it's really important that they make phone call and talk to somebody about that, try and have somebody problem solve how they can access service and still maintain whatever privacy needs, or meet those privacy needs that they have, or the confidentiality needs. But they need to make the phone call and let us help them problem solve. If you think that HIV isn't about you, it is about you. HIV impacts on every person in the community, whether you know it or not. Its impact isn't just on the person that's affected with HIV, it impacts on families within the community and neighbors, and it affects everybody.